So let's talk a little bit about what happens to a patient who has made a decision to have a rhinoplasty or septoplasty. What is the exact process? What are the expectations? What is the recovery like? The cost? Those types of things that are important. Well, every patient that comes in to see us here gets a full evaluation, and then in addition we have very specific instructions about what the patient can expect to go through. Of course, breathing through the nose is a very important part of daily functions. And when we do surgery on the nose, the first question that patients ask is, am I going to have any kind of packing or blockage on the inside of the nose? And I will say that in the past 20 years, we have slowly moved away from using a lot of packing inside the nose because we have better types of procedures. We also have better types of soft silicone splints that we use inside the nose so that there's really no need for any packing. And once we get through that part of the discussion, patients are very relieved to know, because when they talk to a friend or relative, one of the most memorable parts of their experiences was having the packing removed from the nose. Nowadays, patients come in after they have their procedure done. We see patients back usually about 3 to 4 days after their surgery. There's no packing in the nose. They may have a soft little plastic silastic splint to help them breathe better during those first few days where swelling is most significant. And patients will be able to resume most normal activities after about 1 week. Now, the operation that's performed is done in our fully accredited private surgical facility here, both in Palo Alto as well as in San Mateo. So we service patients from all over the Bay Area. The patient will typically have their procedure performed under a general anesthetic. That is where we have an anesthesiologist that makes the patient comfortable. They're totally asleep, so they're basically brought into the operating room. The last thing they remember is listening to some soft music, and the next thing they remember is being in the recovery room with one of our recovery room nurses helping them breathe and apply ice packs to the surgical areas. Patients do not have to stay overnight in a hospital after most rhinoplasty surgery, but they can be returned to home in a more comfortable environment. We have very specific instructions for what patients will need. The most important being the use of ice packs to help reduce swelling. We also use homeopathic medicines such as bromelain and arnica, which really helps reduce swelling as well as postoperative discomfort. The other common question patients ask us is, how painful is this procedure going to be? And that varies, but I will tell you that 90% of our patients do very well with a mild pain pill for the first 2 to 3 days after their procedure, and then they're switched over to Tylenol usually by about day 4 or 5. Afterwards, for the next couple of weeks, there is some sensitivity to the structure of the nose. There is still some numbness to the tip of the nose, and all that tends to resolve. Because we're reshaping the nose, there's also a little bit of tape and a splint that is placed on the outside aspect of the nose that's usually only kept on for about 1 week. So patients can return to school, they can return to work very easily after 1 week. There are some restrictions on extreme physical activities, sports activities, because for the first 4 to 6 weeks after the patient's rhinoplasty, the nose can still be vulnerable to pressure injuries. So the last thing we want to have happen is to somebody who has just gone through their rhinoplasty surgery, something they've been waiting for several years, and then to be either in a basketball game or a soccer friendly match and have an accident happen where a ball or an elbow can traumatize the nose and shift things out of position. That type of scenario has occurred, and we just remind patients that for the first 4 to 6 weeks to refrain from that type of activity. So for a lot of our sports people who engage in both college sports as well as high school sports, we typically will perform their rhinoplasty at a period of time when they're not at the height of their competitive schedule.